الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Non-Communicable Disease Epidemiology and Prevention by Professor Mahmoud Hani Sulaiman. Today I will discuss epidemiology and prevention of obesity. What is obesity? It is an abnormal hypertrophy or hyperplasia of adipose tissue. It may be visceral or subcutaneous. The visceral type associated with insulin resistance and dyslipidemia. Subcutaneous type is the peripheral type. Definition: measurement of weight alone is inadequate. Weight alone is inadequate to indicate obesity. Two standard deviations from median weight for height may be held as cut-off value. Two standard deviations from median weight for height may be held as cut-off value. Skin fold thickness is more convenient. Measure thickness at 4 sites: biceps, triceps, suprailiac, and subscapular. So there are 4 sites to measure skin fold thickness: biceps muscle, triceps muscle, suprailiac crest, and subscapular skin. The cutoff for summation of these 4 sites is 40 millimeters for boys and 50 millimeters for girls, because fat under skin is more abundant among girls. Definition and assessment continued. Waist circumference measured at midpoint of rib cage and iliac crest. Midpoint between end of rib cage and iliac crest. It is convenient, unrelated to height, correlates closely with body mass index. Waist-hip ratio, WHR, is perhaps more significant. Men with waist circumference more than 100 centimeters or waist-hip ratio more than 1, and women with waist circumference more than 88 centimeters or waist-hip ratio more than 0.85 are at high risk of metabolic complications. Waist-hip ratio and waist. Definition and assessment continued. Body mass index, which is very famous, equal weight in kilogram divided by height in meter squared. Weight in kilogram divided by height in meter square. BMI more than 25 is called overweight. BMI more than 25 is overweight. BMI more than 30 is obese. BMI more than 30 is obese. BMI provides most useful population level measure of overweight. BMI at the population level is the most useful indicator for obesity. Obesity, as it is same for both sexes and for all ages of adults. Obesity is defined by BMI for both sexes and for all ages of others. However, it is considered a rough guide due to it may not correspond to same degree of fatness in different individuals, because it cannot distinguish between weight contributed muscle and that by fat. What is the magnitude of the problem of obesity? Globally, in 2005, around 1.6 billion 1.6 billion adults aged more than 15 were overweight, BMI more than 25. At least 400 million adults were obese, more than 30 BMI. 400 million were obese. In addition, at least 20 million children less than 5 years are overweight globally in 2005. Once considered a problem only in high-income countries, but overweight and obesity now dramatically increase in low and middle-income countries, especially in urban settings. Magnitude of the problem of obesity continued. Many low and middle-income countries now facing a double burden of disease, while they continue to deal with problem of infectious disease and undernutrition, also experiencing rapid upsurge in chronic disease risk factors as obesity. It is common to find undernutrition and obesity existing side by side in the same country. Double burden is caused by inadequate prenatal infant and young child nutrition, followed by exposure to high-fat, energy-dense diets, micronutrient-poor foods, and lack of physical activity. In Egypt, this table shows obesity adult prevalence rate about one-third. Now, here in 2013, about one-third. Agent of obesity: genetic, diet, decreased intake of macronutrients, Cushing, hyperthyroidism, excess smokers, alcohol, drugs, and anxiety. So, genetic, probably multifactorial. Diet, increased calorie intake, especially in form of saturated fat, refined carbohydrates. Children are made to be addicted to junk food from early childhood, so they grow obese at very early age. Decrease intake of macronutrients, which lead to adipose tissue increase. Cushing syndrome, hyperthyroidism, ex-smokers gain some weight, alcohol thickens men but thins down women, drugs like steroids, OCPs, insulin, and beta blockers, and anxiety. Certain pattern of behavior due to stress eating when individuals become dependent on glucose for mental well-being. Host factors of obesity. Men are more overweight, but women tend to grow more obese with each pregnancy and become maximally obese between 45 and 49 years of age. About one-third of obese people be so since their childhood. Physical inactivity is not confined to the developed countries due to increased sedentary work. Many forms of work like information technology, call centers, computer accounting, and due to easier modes of transportation, cars and so on, and due to urbanization. Complications of obesity. First, almost inevitable, type 2 diabetes, gallstones, dyslipidemia, dyspnea, sleep apnea. Almost inevitable, type 2 diabetes, gallstones, dyslipidemia, dyspnea, sleep apnea. Likely to occur, ischemic heart disease, hypertension, osteoarthritis, gout. Likely to occur, ischemic heart disease, hypertension, osteoarthritis, and gout. Probably occur, cancer, prophylactic ovarian syndrome, low back pain, fetal defects. Probably occur, cancer, prophylactic ovarian syndrome, low back pain, and fetal defects. So complications of obesity are three: almost inevitable, likely to occur, probable, occurrence. Prevention of obesity. Aims of prevention of obesity. First, to maintain BMI within 18.5 to 24.9 through adulthood, to prevent weight gain more than 5 kg anytime during adulthood. For those who are obese, already initial goals is 5 to 10% weight reduction. This is framework for childhood obesity prevention. It is almost like adult, but the role of family, home of the family, is less among adults. So it will begin with the child himself, individual changes, knowledge, skills, and motivation. On the environmental change and home health education, community-based health education mainly, health and the less advertising for junk foods, healthcare system, more training for catch and treatment and prevention of obesity, food supply to increase the supply of less calorie food, urban design and transportation system to help some walk, media to less advertisement of bad foods and more advertising of good foods, and more programs about healthy foods. Legislation is through that every product must put on the pack what is the components of calorie in details. Primary and primordial prevention of obesity. At individual level, parents must train children on good dietary practices and protect them from junk food marketing campaigns. Limit energy intake from total fats and shift fat consumption away from saturated fats to unsaturated fats. Increase consumption of fruits and vegetables as well as legumes and whole grains and nuts. Increase fibers in diet. Decrease intake of sugars. Increase physical activity, at least 30 minutes of regular moderate activity on most days of the week. Although market is flooded with appetite suppressants and liposuction therapy, easier cost and side effects prohibit them to be effective community intervention. Feeling of being fat and its psychological consequences. Children who feel fat have lower self-esteem and feel worse about themselves than children who are actually fat. Girls generally overestimate their body weight more than boys, while the latter frequently underestimate their body weight. It is only natural that some normal children will feel fat or thin relative to these ideal figures and become victims of depression. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.